Hello, this is Leah Carlisle and Susan Matthews. We will be doing a complete head to toe check off, a complete health assessment. So we will begin that now. Susan's going to be the patient. So I gather my equipment. I have my pen light, my otoscope, my stethoscope, and any reflex hammer things. I've gathered my equipment, I've provided privacy, I've obtained proper lighting. We're in a lighted area. I have washed my hands, observed the general appearance of the patient. She is dressed appropriately. She doesn't have any physical deformities. Her mobility is intact in her range of motion. Susan, can you move your arms up and down without any pain?
No, we're good.
Okay, and there's no pain there. Her clothing's appropriate for the season, except she's wearing a t-shirt, but we are inside. She does have long legs on, long leggings. She's clean. She's not disheveled. Her skin color is warm, pink, and dry. It's not pallor. It's not reddened. Both of her hands and nails are intact. There's a little bit of dry and flakiness, but she's a nurse. She washes her hands often. Her nail beds are fine. Her posture and positioning is intact and appropriate. She has a normal posture. Her affect is normal. She doesn't have any noted agitation or anxiety or restlessness. Her mood is appropriate to the situation. She's content, relaxed. Her speech is clear. Susan, can you tell me your name and date of birth?
Susan Matthews, July 6, 1991.
And her hearing is intact. She can hear me just fine. And her nutritional status, based off of Susan's chart and based off of her body, I know that she eats normal healthy meals and she's active. She's a runner. She has normal eating habits. She has eye contact when I speak to her. That is intact. And her level of consciousness is awake and alert. Her orientation is, she's oriented *4. Susan, where are we today?
Leah's apartment.
And why are we here?
For a head-to-toe assessment.
All right, so she's oriented *4, person, place, time, situation. Her scalp is fine. She doesn't have any lesions or scars or wounds. Her face is symmetrical. Her hair is clean and intact. Her cranium is intact. She doesn't have any broken bones. Her temporal arteries are intact. Her temporomandibular joint is not impaired, and her maxillary and frontal sinuses are not swollen or abnormal. I've checked her peripheral vision here. Susan, can you cover your, can you look straight at me?
Okay.
And tell me whenever you start to see my hand.
No.
And my hand.
No.
Okay. And can you look at my pen light? And back of the wall? Back of my pen light? All right, her eyes are equal, round, reactive to light, and accommodating. Both of her pupils, her opposite pupils dilated, and they're reactive to light. And then her 6 cardinal positions of gaze were intact, with her cranial nerves 3, 4, and 6. She doesn't have any conjunctiva, sclerae, corneas, or irides. Her pupil size is about 3 millimeters. I would test with the Snellen chart. I would have her read from the recommended distance and read the smallest line that she could read from the letters down. That would be the Snellen chart. And then that would determine with one eye and with both her vision, whether it be 20/20 or 20/15. Her external ear is fine. Observing with an otoscope here, she has no abnormalities in her canal or tympanic membrane.
Yes.
I whispered and she can hear me talking. Her hearing is intact. There's no symmetry or lesions, or there's no asymmetry or lesions with her nose. Up her nostrils, there's not any mucus or drainage or lesions or abnormal findings. if I need to inspect anything, I would check her sputum or her septum and her mucosa. Inspecting her mouth and throat, her buccal mucosa is intact. Her teeth, gums, tongue, the floor of the mouth, the palate, the uvula are all conditioned in normal condition. Her tonsils are not present. She has a tonsillectomy. And her gag reflex, can you say ah? And I poked her with a stick and she responded with a gag reflex. Her vagal nerve is intact and working. Her neck is symmetrical. There's no masses, pulsations. There's nothing abnormal when I palpate it. Her jugular veins are not distended, showing no signs of edema or heart failure or any problems with that. Her range of motion is good. She can move her neck. She's been doing that throughout our assessment. Her muscle strength is adequate. Of her thoracic cage, she has symmetry of shoulders and muscles. She has symmetrical expansion here when her chest rises. There's no mass or tenderness here. I'm going to do her breath sounds here. Deep breath in your nose, out your mouth. I would compare right to left and have her breathe inhale and exhale with each movement. Her breath sounds posterior and anteriorly would be, they're all clear throughout all fields. And with her heart, we have the aortic, pulmonic, tricuspid, and mitral valve. And I'll listen at the apical when I get to the bottom for 1 whole minute. And her heart is regular. There's no sound of murmurs. There's no rhythm, dysrhythmias, or abnormalities in her rhythm. Her brachial and radial pulse are both equal, bounding, present. Muscle strength in both hands. Can you squeeze my fingers, Susan? It's strong, equal bilaterally, the grips. And having her lay down now to inspect her abdomen. Oops, sorry, Susan. You can lay down.
This way?
Yeah. So upon inspection of the abdomen, I would look for contour, symmetry, skin characteristics. It's warm, pink, dry throughout, just like her upper extremities and everything else that I've assessed this far. There's no abnormal contour. She has normal appearance and symmetry. There's no masses. I would listen next. In all 4 quadrants, right lower, right upper, left lower, for 5 to 34 seconds in each quadrant. Her bowel sounds are audible and active in all quadrants. They're normal, active. I would palpate the 4 quadrants, light and deep for the liver and spleen. She doesn't have any tenderness here or masses felt. But she is a little bit ticklish. And so in her lower extremities, I'm assessing for symmetry, skin characters, it's warm, pink, dry, hair distribution, there's no abnormalities. Her varicose veins, she doesn't have any. I would palpate her pulses here, as you can see. Her pedal pulses would be here, her post-tib right here. And then her popliteal, the dorsalis pedis, I did that. I'm going to test her range of motion. Can you move your hips and knees up? And she has no abnormalities in her range of motion. She has very good range of motion and muscle strength. Her joints and her deep knee bends are fine. They're intact. Her spine, I checked when she was sitting up, and she had no sclerosis or kyphosis, no sway back or anything. Her range of motion in her spine was adequate because I saw her go from sitting to standing and sitting to laying. Babinski reflex here with her foot. And her toes fanned out there. And she has, Susan, can you sit up for me? Can you touch your finger to your nose like me? And the other one?
Okay.
Very good. And both? Thank you. She can do the heel down opposite shin test. She's done that upon request. And she has sensation in her face, her hands, her knees, her legs, her feet. Throughout the assessment, she was appropriate in her response to sensory. Her deep tendon reflexes were palpated and they were intact. Her brachioradialis, her patellar, and her Achilles. She has made age-appropriate lifestyle choices, and the examination is finished now. Susan, do you have any questions?
I do not.
All right. Well, awesome job. Thank you so much for being my patient today.
Thanks.